How to use electromyography. Electromyography is a diagnostic tool frequently used for quantifying muscle tone. It records the electrical activity of muscles using surface, firewire, and needle electrodes. During muscle activation, the record will show deviations away from a straight isoelectric line. The number and sizes of the deviation give a measure of the amount of muscle tissue that's electrically active during the contraction. Some of the advantages of electromyography include sensitivity to low levels of muscle activity that may not be readily palpable by an examiner. Also, precise timing of muscle activation or relaxation can be detected by EMG and matched in time to command to contract or relax. Provide biofeedback to a subject who is trying to learn how to initiate contraction or relaxation in a particular muscle group, and also differentiate between neural and biomechanical components of muscle tone, which palpation alone is unable to do. A few disadvantages include ability to monitor only a local area of muscle tissue directly adjacent to electrode, and also muscle tone and active muscle contraction cannot be distinguished from each other by looking at an EMG record. An example of an EMG machine would be electromyography machine is this contraction here. You have the electrode pad, and you also have the cord, the wire that hooks from the electrode pad to the machine. All right, now I have the electrode pad attached to the distal bicep to test the contraction of the muscle. This will test the activity of the muscle and how strong the muscle is. You would compare it bilaterally to make sure to determine which muscle it may be stronger as well. So you will hook this into the machine on the side, and you will turn it on. On the first one is going to be the contraction, and what I have her do right now, her arm is completely resting, and you can have it on the lowest contraction, the lowest type of intensity, so that when she just maybe moves her arm, so maybe just flex your elbow, it'll go all the way up. You'll hear it beeping. So when she relaxes it, the beeping will lessen, and she won't have as much beeping because her muscle is not contracted. Now, if I turn it to a higher intensity, and she will have to do a lot more to make it contract, so that helps as far as with the strengthening. So if she flexes her muscle, she has to go up a little bit higher, make a muscle. That's when they'll go back up. She has to work a little harder to make the noise for it to beep a lot more. And so just contract your bicep while it's resting, and then bring it up. There you go. All right. And now you see as the beeping continues and it goes a little faster. You also have a threshold method where you can actually turn to a threshold method, and you can change the intensity and the strength, and you can also change the threshold, and you can make it easy where you will put it at maybe a 1, a 0.7, 0.6, 0.5, or a 2, 3, 5, or 10. Putting her at maybe a 1 would check and see just how strong she is. Maybe it's an easy thing, so maybe just flex. She doesn't even have to really contract her biceps. She can just pull her arm up. Then if she relaxes, the beeping goes down and is back to the green light. Then I'll go and turn her up to maybe a 3 to see which one is tougher for her. So now just bend your arm up. She had to go up a little higher for the beeping to start. So that would be one of the ways in which you would do that. And this just tests basically the strength of the muscle contraction as well as the electrical activity that is in electromyography. You can use this to determine the strength of a muscle as well as how much of it is contracting. Thank you.